challenging issue of traveller-related conflict. I'm taking as a starting point of this presentation that everybody knows who travellers are. Travellers are in business in Ireland who suffer significant disadvantage and have very poor outcomes in relation to a range of socioeconomic issues such as education and health. There was a health study, or Ireland Traveller Health Status study carried out in 2010, which identified significant disparities in life expectancy, 6.5 times greater suicide rate, and a number of very damning statistics in relation to travellers' health. So our brief is traveller health, but we got involved in mediation through the Midland Traveller Conflict Mediation Initiative. We've done a lot of work around the partnership, convening the partnership, and supporting the work around this. So I'm going to take you through a bit of feedback and give you a bit of insight into the work that we've carried out. So the MTCMI, or the Midland Traveller Conflict Mediation Initiative, was set up as a traveller interagency response to a traveller-related conflict in the Midlands. We had a lot of conflict. I think most people in Ireland will be familiar with traveller-related conflict. It's got broad coverage in a lot of media, and it's broken out in a lot of areas now. We have particular acute issues in the Midlands, and we weren't able to do any community development or any education development or any other types of development in the context of community at war in some places. So we carried out research which was commissioned by the Department of Justice in 2008, and we received funding from the charity and from the Department of Justice. The initiative has been mainly funded by the Department of Justice since its inception, and we had staff delivering mediation on the ground late 2009 and since. So it's been supported and developed through interagency work. There's an interagency format in each county to address traveller issues. Traveller issues are seen to be more complex and challenging than most issues, and they need an interagency response. That interagency functionality varies in a lot of counties, but I suppose we were able to harness broad support for this issue, and I'll take you through the feedback there. So as I said, the interagency response to an interagency issue, the stakeholders are very broad, as well as travellers. The Gardaí are one of the main stakeholders, local authorities, probation service, prison service, judiciary, schools. A lot of schools were coming with issues such as high rate of absenteeism or conflict in the community causing absenteeism, in the excuse for absenteeism, and the traveller health unit, that's where I was operating out of. We were delivering traveller health initiatives that were kept falling down or couldn't be developed because of conflict between families and competition for resources, and families, and a small number of families defining themselves around conflict. And we had a dynamic of what was often referred to as high status families, and then families that is disempowered generally, and families that were disempowered within their own community because they were going to be the whipping boys in their own community, because they wouldn't perceive to have any power or any status in relation to conflict. So the travellers, in the context of being disadvantaged and disempowered, were using conflict as a way of getting some power within their own community, and it was negatively affecting everything. Their health was negatively affecting the existing prejudice and discrimination that was going on against travellers. It was another stick to beat them with. The Traveller Primary Healthcare Project, so the HSE, VCs, and social protection departments have invested in training up travellers to be community health workers in a lot of areas. So we had traveller peer workers working as health workers. These travellers then obviously contributed a huge risk to that work, and some of them were made available because of conflict, and some of them, their work was been stymied because of conflict. And they had to learn themselves and how to work, how different travellers had to come to the same workplace to work together. The local parish companies and I named 2 travel organisations there, some of the national travel organisations also receiving stakeholders in this. So So the key areas of work include trying to develop systems, mediation, development work, capacity building, communications, stakeholder engagement, and advocacy. Okay? So, in terms of the caseload, then, just 3 slides to give you a bit of insight into some of the caseload that we're dealing with. So, case A, there are mediation between 3 related families. Midland family with long-standing involvement in conflict and family outside the Midlands, based on one for 18 months with court sentencing postponed. Mediation between 2 traffic families, Midland-based. Mediation between Midland family and long-standing involvement in conflict-related families with another country. This case involved high threats. Travellers asked for intervention for mediation, and the case took 8 to 10 weeks, but was resolved. So we have a variety of different scenarios here, and a variety of different issues. And a lot of people, I suppose, a lot of the settlement community will be aware of some of these issues. The social media, cyberbullying has become a big issue in general population in Ireland over the last 3 years, particularly. But social media and cyberbullying has been an issue for longer than that for travellers, between YouTube videos and travellers physically. While the VHS tapes were still in operation, were physically making VHS videos and distributing hate messages directed at different families. So that kind of methodology has been well used and exercised in the trial, and it poses a particular challenge for us because it's so insidious. Another 3 cases there. Just do the middle case there, just kind of gives you another insight into some of the complex issues there. You have all females, you have threats, you have offending behaviour, and while we've got a resolution there, you're going in to solve something. It could be a sticky blast you're putting on it. And I suppose the learning from the NTCMI is that that we need to intervene early, we need to do prevention work, we need to start talking with young travellers, we need to try and open up the whole idea of peace building within the community, as if that we are in a war-torn country in this community and we need to build peace and build acceptability to be involved in peace. The bottom case there, 20 different family units involved in burial compliance, court cases, drug issues. So that just kind of gives you insight into some of the very complex and sensitive issues that come up. And in the face of this, it's very easy to get attracted to this kind of spiraling dynamic of dysfunction and not do your prevention work. And that's, I suppose, for one of the years of our work and where we lost a member of staff and we didn't have secure funding, we were just doing mediation. We weren't focusing on training, and the lack of security around funding made that very difficult for us. But we've got a secure funding line at the moment, and we're able to plan better, and we are doing more training. We're engaging agencies in training, so the agency knows where we're coming from. The bottom case there is another typical one: traveller, family, and a local authority at war. The case involves negotiating pre-antisocial behaviour accusations and discrimination accusations. And both parties refer to the case against NUIG. A lot of cases coming from Gardaí, a lot of cases coming from travellers themselves. And travellers being able to build up good relationships with the mediators was key. Trust, obviously, was key, and the confidentiality around the issues. But that the mediators had to be able to access good and accurate information from a local authority person, from the guard, and from the traveller, and keep that protected in terms of getting a positive outcome for all. So some of the feedback then, that was the function of this presentation, to bring me on to that. So we did a brief questionnaire by phone to travellers and by phone and email to agency staff by non-staff member. So I think the feedback gives a lot of insight into the value that the different agencies got out of the initiative. Sometimes it's obvious who's talking here. The big thing we did was to get men involved, to get travel men involved is an easy thing to do. Just by sitting down and explaining he wasn't precise and that he wasn't with guards, they were able to trust him. Okay, so that's obviously, that's a traveller himself speaking. But we had peaceful trials going through the courts, but it's nearly outside the study helped us settle the dispute in a peaceful way rather than a violent way. When Joe was one of the mediators, was at this conference, but not themselves out. He was easy to talk to, easy to explain things to, and he took it from each person's point of view, showed us that there were other ways to sort out conflict, like passing each other, then lying on the ground. He does take interest in trying to help, and if he says he will try, you will, and you'll get back. I'll just highlight one or two more of these here. The main issue is the lack of trust between the guards and the travellers. The guards can often take sides without knowing the facts. They don't know the history of it and won't bother asking why these people would get so violent. If the guards decide who's the victim before looking into it, then they might be looking up the real victims who might have got a lot of bullying over time. So that's the traveller's view of, the guards don't have the time to get into this, so they can't see it in a black and white way, or else down all, and everybody is down and pays their own brush. The top quote there is from another traveller who felt, he'd never been involved in that before. As he said in the middle of the quote, that I was sick of it, and the guard was sick of it. I was never in trouble before, I had no conviction. The guards never knew me before this, before he got involved in the feud. And I'd never been in trouble against these guys either. It was just a family feud. I was up for a threat that I never made. Sean helped us out, and I'm grateful for that. Just kept the peace, and now we're talking. Now we're not talking, but we pass each other and there's no trouble. So it doesn't seem like rocket science, but before this there was nobody to play that work between the lines to make that communication possible. That would have trust from the agency point of view and trust from the traveller point of view. One of the interesting points there on the bottom quote, and I know I'm nearly over time here now, is that some of the travellers feel that, or felt at times, that we're getting too close to the power. If the power is in the local authority, the power is in the guards, and the power is some of these agencies, then that, the mediators making friends and influencing people all over the place, and that some of the travellers thought that, they're trying to use the mediator to get off the case and get good reports, or try and work with the agencies to suit themselves. One of the other pieces I want to highlight is the travel organisations themselves were struggling with travel conflict and utilised, and that's really the second quote there, that one of the travel projects got training in travel conflict, and really they benefited as a team, and because they have a traveller team of staff, then they obviously need to have clarity around conflict when it comes into the workplace. It's not just a workplace, it's, they're bringing that home as well and living with it, so it's really challenging. One of the guards there said back at the bottom of the quote there, the agency might the guard provides a transformative approach to travel feuding and travel cultural issues. Provides connectivity between the guards and the travellers to schools and so on that wasn't there before. And this is one of the most positive things.